headlines today: dark side to meditation, early menopause, less vegetables, and antacids, higher risk for diabetics. Buddhist-derived meditation has become popular in the West as a form of health promotion, but there is an intensely distressing side that's never mentioned. A US study recruited 60 Buddhist practitioners and teachers who had had challenging, difficult, distressing, or functionally impairing experiences related to their meditative practice. The researchers divided 59 symptoms into 7 domains: thought, perception, emotion, motivation, sense of self, social, and physical symptoms. 82% of the practitioners reported fear, anxiety, panic, and paranoia. 50% reported social impairment, hallucinations, sadness, and irrational beliefs. Many felt physical pain, had insomnia, or relived traumatic memories. The duration of these effects lasted from a few days to 10 years, with a median duration of 1 to 3 years. 3/4 said that they had moderate to severe impairment in at least one domain, with 1 in 6 reporting suicidality and 1 in 6 needing hospitalization. Surprising results for something promoted as health-giving. A woman may prolong her reproductive years by the food she chooses to eat. Early menopause, before the age of 45, affects 5 to 10% of women and is linked to many issues from reduced fertility through to premature death. Analysis of 85,000 women from the Nurses' Health Study has found a lower risk of early menopause among women consuming the most vegetable protein. A 1% increase in vegetable protein consumption is linked to a 6% decrease in the risk for early menopause. 1 serving of pasta a day was linked to a 36% lower risk, but eating 1 serving of red meat a day increased the risk by 12%. Another reminder of the importance of diet when it comes to aging, even ovarian aging. Adults with type 2 diabetes who also take proton pump inhibitors or PPIs for GERD may be at risk for accelerated renal and cardiovascular disease. A recent study from Perth, Australia, involved around 1,000 diabetics to see if PPIs impacted their health. 1/3 of patients required PPIs during the 2-year study. Many were already on the medication when the study began. However, those who were started on them during the study had a significantly and persistent drop in kidney function. Diabetics on PPIs reported having a cardiovascular event, that's a heart attack or a stroke, 2 to 3 times more often than those not taking them. So if you're diabetic with gastric reflux disease, think about the risk of kidney impairment, heart attacks, and strokes before starting a PPI. I'm Dr. Nerida McKibben, and that's today's Health News.